Okay, ready to get started? Good afternoon. It's 12 o'clock, and welcome to everybody. And I don't think there's going to be any surprise here that I'm going to vehemently and adamantly oppose the governor's proposal to do away with the Department of Drug and Alcohol Programs. And on saying that, I just want to say a little bit. I mean, I like the governor. I really think he is a good man. I know he very passionately cares about this issue of addiction and treatment. Just this morning, he made an announcement that he's putting $10 million more into Narcan, which is that life-saving drug across the state. He's going to propose in the budget. So I really know he cares about this very much, as I do. But we have a disagreement, and this is not personal. This is about policy and where we're going moving forward. So, you know, I'm going to oppose this measure, and I'm going to also propose some restructuring of the department and why I oppose this. You know, the stories we're hearing around the state, one after the other, they get worse and more outrageous and appalling as we hear them. Over the Christmas holidays in Philadelphia, 35 people died over a weekend from overdoses, heroin laced with fentanyl. We had a case out of Mechanicsburg where a little girl, first grade, got on the bus and told the bus driver that she couldn't wake her mom and dad up and she had to dress herself. The bus driver called the police and they went to the house, and both her mother and father were dead in bed from an overdose, heroin overdoses, with two younger siblings out in the house. Out in Johnstown, same thing, a couple overdosed, but unfortunately and just tragically, they had a little baby in the house with them. And before they found them, it was 3 days, the baby had died also from malnutrition and dehydration. Just Saturday in Philadelphia again, two sisters were killed on the Roosevelt Boulevard by a speeding drunk driver. So the stories that we're hearing are just appalling. And again, a lot of it and much of the discussion has been about the opiates and the heroin overdoses. And I've been working on this issue for almost 20 years here in the legislature. I've been very open about my son being a heroin addict, and that's how I took a real interest in this area of addiction and treatment. This is a terrible disease, and we have to look at it as a disease. But what I've learned through the years is that treatment works, and that treatment is highly successful if you can get the right treatment for the proper length of stay. A little bit of the history on the Department of Drug and Alcohol Programs. I was the person that authored the bill. We got it passed and signed into law in 2012. At the end of Governor Rendell's administration, he signed it into law. Governor Corbett came on the following year, and then he implemented and instituted the department and named Gary Tennis the first Secretary of Drug and Alcohol Programs. It raised it to a cabinet level position. And Gary has been secretary through the Corbett administration and for the first 2 years of the Wolf administration. And he got let go last week. And, you know, we all know the stories. We had a press conference last week. He got let go because he told the governor that he would not go along with doing away with the Department of Drug and Alcohol Programs. Now, the proposal that I've seen so far, and I think we're going to get more details next week, but what I've seen so far from the press releases is that they're going to combine this department in a new, I guess, Department of Health and Human Services. And we've been there before. Friends, we've been there before. It just doesn't work. It doesn't work being buried in a large department full of bureaucracy that has 100 other issues that they're dealing with. This needs to be a priority for us here in Pennsylvania, and that can only be accomplished by having a department and having a cabinet-level official. Now, it's not going to be Gary Tennis anymore, but, it's going to be somebody else, hopefully, that's going to lead this department. We need somebody in the room when decisions are being made, when legislation is being discussed, when there's budget negotiations going on. We need a cabinet-level secretary in the room when those decisions are being made. Since I found out last week about, this proposal to do away with the department, I've really looked at this, not only the department, but I've looked at the other departments where there are pieces that deal with drug and alcohol treatment, education, policy. I've looked at all of them, and in your packet, I've come up with a kind of proposal of restructuring the department as it is now and moving many of the pieces that are in the other departments, moving them into this Department of Drug and Alcohol programs and leaving it freestanding as it is today. And I'll just very briefly go over with them. In the Department of Human Services, we have the Office of Mental Health and Substance Abuse Services, OMSAS. What I think makes a whole lot of sense is part of that office, it's mental health and drug and alcohol, move the part that deals, it's a policy office, move the part that deals with drug and alcohol into the new department. In the Department of Education, there's a safe school office with support for K through 12 drug and alcohol abuse prevention and education, abuse education, and student assistance programs. That certainly would fit in the Department of Drug and Alcohol programs. In the Department of Health, there is, which just got up and running in August, the prescription drug monitoring program. As a matter of fact, when I had the bill to create the PMP, actually in my bill, I had that prescription drug monitoring program going into the Department of Drug and Alcohol programs. As we went along and had discussions, it was agreed to put it in the Department of Health, but that could certainly fit in drug and alcohol. And the Department of Health also, there's a Bureau of Informatics and Information Technology, which is mainly research that deals with drug and alcohol. We also, in the Department of Human Services right now, have the Center of Excellence, which has just got up and running, which was proposed by Governor Wolf last year. I believe there's 45 of them that are going to be up and running all across Pennsylvania. And they deal with Medicaid patients and addiction. I mean, they could certainly fit in the Department of Drug and Alcohol programs. At the bottom of the list is make sure that we have, that DTAP would have an attorney, a human resource person, an IT person. Right now, they share those people with other departments. And just another thought, the medical marijuana piece that's in health right now. I mean, I could fit in the Department of Drug and Alcohol programs. So just want to throw these ideas out there. I talked to our appropriations chairman last night, our Republican appropriations chairman, Representative Sansaler. I mean, he's willing to help me, the staff of the Appropriations Committee, willing to help me see how this would all work out in this new department. And again, the history of Act 50 that created the Department of Drug and Alcohol, 2012. And I just want to reiterate and bring to everybody's attention, it passed out of the House almost unanimously. I think there were 2 or 3 negative votes. Everybody in leadership, including the Speaker, the Majority Leader, and the Appropriation Chairman, who were there in 2012, voted for that bill. Voted for that bill. And I just think so many people just think it is the right thing to do, especially in the middle of this epidemic. And again, this is just a terrible disease. And everybody wants to talk about these delivery of services and integration and saving money, but this should not be about how much money we can save. It should be about how we can get the services to the people that need them and have addictions. As I looked at the governor's press release yesterday, He's proposing to do away with the department, but then I see he's also proposing to implement a new cabinet-level position. Kind of like, as I read it, a cabinet-level position that's going to take care of the opiate and heroin problem that we have across the state. I want to remind everybody, while opiates and heroin are getting a lot of attention, and rightfully so, there are many, many other addictions that we have to deal with. Alcohol, by far, is still the #1 abused drug in our state and across our country. We've got a terrible methamphetamine problem in the state of Pennsylvania. Still, we have a cocaine problem. So, creating a cabinet-level position that just deals with opiates and heroin, I mean, there are so many other people that have other addictions that we have to be aware of. So I just don't know how that makes any sense. You're going to do away with the department and create another cabinet-level position, more bureaucracy. Is that what we need? More bureaucracy? I mean, I think this department is working well. I really do. And I think it's the right thing to do. And again, it was the will of the legislature that created this department. In your packet also, and I'm just going to touch on these briefly, there's a couple of other things that I think would really, really work well. The first one is a co-sponsorship memo that I sent out to create a 10% impact fee on the sale of opiates here in the state of Pennsylvania. We estimate that would be about $75 or $80 million, and most of the money would go to the department that would filter down to the counties. There would also be money in there to purchase Narcan, what the governor just proposed, and also money in there for our counties for the impacts that addiction creates on our criminal justice system in our counties. And the second part that I would like to bring to everybody's attention, Pennsylvania, like all the other states, is receiving federal money to deal with the addiction. We're going to get $25 million this year and $25 million next year. The administration right now, my understanding is, I believe they have to come up with a proposal how they're going to spend it by the middle of February. The administration right now is looking at ideas on how to spend this money. I've heard from a number of legislators, and I know myself from personal experience, that in the state of Pennsylvania, on the weekends, and I'm talking about Friday, Saturday, and Sunday, you cannot, on most weekends, find an empty detox bed in the state of Pennsylvania. They're full. And again, mainly because of the opiate and heroin problem. You can't find a detox bed. If we're going to get that $25 million, I mean, there's a lot of state buildings that are empty around the state. Why don't we open some of them up, let the drug and alcohol providers come in and open detox beds and treatment beds for some of these people? I think it would be a pretty simple process. We could use that $25 million maybe for rehabilitation of the buildings. I think that's a feasible idea, and it certainly is a much-needed idea. So I'm throwing some of these things out there, but the main purpose of what I'm here today is that we've got to keep that department. This crisis and epidemic that we have, and again, it's just not about opiates and heroin. It's alcohol, methamphetamine, it's cocaine. I mean, we've got to have a cabinet-level position with a department underneath him. I mean, I don't know what this cabinet-level position that the governor's proposing. I mean, what are we substituting somebody that has real authority for maybe a figurehead? And I don't know, it just doesn't make any sense to me. So with that, we're going to take your questions, but I'm going to let Representative Tom Mert, he has some remarks today also. I also invited Representative Aaron Coffer here today. Also, Tom and Aaron are the subcommittee chairman on the Department of Human Services. Aaron could not be here today, but he just wanted me to let everybody know that he also very much supports keeping the Department of Drug and Alcohol programs in place just the way it is. So with that, I'm going to bring Representative Tom Mert up for some few short comments.
Good afternoon, everybody. Thank you for being here. It's good to be able to support my colleague and my friend, Representative DiGiralomo. I want to concur with what he said about the governor at the beginning. We know Governor Wolf to be a leader of great compassion and empathy and devotion to human services. And we just have a disagreement of which way we should go with his proposal. I support efficiencies in government wherever they can be achieved, but this proposal by the governor has been made with precious little detail for us to discern. This is a massive transformation of a large part of state government with few particulars for us to consider. For me personally, the most important aspect of these proposed mergers is the fact that we're talking about merging missions and possibly cutting programs and services that will adversely affect the most vulnerable of Pennsylvanians. This action by the governor also raises questions of decentralizing services and whether combining services and trimming the workforce will mean longer waits and fewer people receiving programs and services in a timely manner. I especially would like to know how this system may impact those adults with special needs and their families. That might not be part of the merger, but we're concerned about that. While every elected official wishes to save money where we can, this cannot be achieved at the expense of those who badly need programs and services to survive. The reality relative to adults with special needs across the Commonwealth is that we have a great number of people on the waiting list for services, and these include many adults who have intellectual and developmental disabilities. Last year, we dedicated more money than ever before in the history of Pennsylvania to shrink that waiting list, and this increased funding was achieved in a bipartisan fashion. But the money was absorbed to care for people already receiving services, so we weren't able to pull anybody off the waiting list. The waiting list for adults with special needs remains too long, with many families waiting years and years for services. And I remind you that some of these families have parents who are 85 or 90 years old, and they're caring for a son or daughter who's 60 or 65 years old. The parents are struggling with age and health-related issues, and so is their adult child. This mission of serving adults with special needs is already underfunded. And having said that, before we embrace the governor's proposal, I think we need a detailed strategy for how these proposed mergers will help shrink our waiting list. In conclusion, any restructuring of government services is worth discussing, but we must move cautiously, prudently, and include input from the legislature and those on the front lines of the human services mission, and with one overriding consideration in mind. How will this restructuring impact those Pennsylvanians who depend on programs and services to live each day? Thank you.
Okay, with that, open up for any questions.
Well, clearly Governor Wolf and his administration was selling this idea as providing a one-stop shop, making accessing government services a lot less complicated for Pennsylvanians. And I mean, do you see there being any way to take your idea and pull it?
I just disagree with that. And with the Department of Drug and Alcohol programs, I mean, we were there before for such a long time, and it just didn't work being a bureau in a large department. And back then it was in the Department of Public Welfare. It just didn't work. You had a bureau and you had the head of a bureau, but they weren't there when decisions were being made. I mean, it just didn't work. And I think if you go to the field, out in the field, for everybody that deals with drug and alcohol, they will tell you the same thing. The bureau was just buried in a large department that dealt with 100 different issues. And I don't know how it could get the recognition that it deserves, this problem deserves. So I just disagree with that. I mean, we're talking about, I guess, a new name, the Department of Health and Human Services. I mean, we're just going to have a behemoth of a bureaucracy. And you can't bury this important issue in a large department like that. It just doesn't work. We've been there, and it didn't work back then, and it's not going to work today. Anybody else have any questions? Be glad to answer. And again, I'll just close with this, if no one else has any questions. I mean, this is a disagreement about policy. This is not a personal disagreement. And again, as Tom said, the governor really cares about this issue. But we just have a disagreement on what direction we need to go. And I think we need to keep this department. And I'm going to do everything we can to fight to make sure it stays right where it's at. It's that important. And again, thank you, everybody, for being here. Appreciate it.